Hey movers, today we are going to be getting into hip cars. We're going to be doing the most basic level today, which is laying on our back. So let's get into it. So you are going to get into this position where you're just laying on your back. Before we even start to do the cars, I want you to put your hands on the soft part of your belly and either laugh or cough. And since it's COVID season, I'll cough. Right? What I feel is my abdominals push out into my hands. So I'm just going to recreate that feeling. I'm going to push my abdominals out into my hands, and that alone flattens my entire back along the bottom of the floor. Keeping this brace, I'm going to get into our hip cars. So starting off, I'm going to bring my leg up, and I'm just going to tap my knee. I like to do this so that I really focus on bringing my knee as far up as I can, and then letting it fall out. Letting my knee fall out, and then just bringing it back to the start. And again, bringing it up. I'm going to tap so that I get as much hip flexion as I can. And then I'm going to keep that hip flexion, keep that hip flexion, keep that hip flexion until I get out. I fall out as much as I can. And then from here, I'm just going to let my leg bring back in. And to reverse that, again, push out, flatten our back against the ground. I'm going to bring my knee up and out. Again, now I'm going to start tapping to keep bringing my knee up as much as I can. Bring it up, bring it up, bring it up. Keep pulling. Again, these aren't passive. These are a nice active mobility drill. Bringing it up to the side. Start tapping my knee because I want to bring it up as much as I can before I even start to bring it in. Good. So if you can do that, and having a good abdominal brace keeps your hip from popping and that uncomfortableness, then that's great. Keep doing it like that. However, if you are someone who is getting pain in this, so when we reverse it and we start to bring it here, and as we're bringing it in, you just get so much, hey Dodo, you get a ton of hip flexion, hip flexor pain, especially as you come up and you start to adduct, and especially as you start to bring it out. Maybe you fall into a cramp, or it's too painful that you can't even do it. I'm going to teach you a way to keep it into more internal rotation to stop that pain from happening. So what I mean by that is that doing this in reverse, bracing out back against the ground, as we come up, right, my knee is up as much as I can. I'm gonna think of bringing my knee up first and letting my foot fall behind. So now my thigh is in external rotation here. And so now I'm just gonna bring it up and I'm gonna lower it in a little bit of external rotation. And so now all of that hip flexor pain that you may be experiencing is gone, because instead of recruiting more from your hip flexors, we're recruiting more from your TFL, which helps to act as a hip flexor. So again, that looks like this. Bringing it up to the side, knee, 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 knee. Knee comes up as much as you can before you start to bring it in, and then knee comes in first. Knee comes in first. Foot is falling behind. Foot is still behind as I bring it back down. All right? And as we start to strengthen into those hip flexors, that pain will get better and we won't have to internally rotate as much. But if that's what we have to do so that we can get some motion in that joint, then so be it. That's totally okay. So let me know how these help.